You're on the Faculty Factory podcast. I'm Kim Skorupski at Hopkins looking at Dr. Alice Fornari. Hi, Alice.
Hello, Kim. Wonderful to see you.
You too. This is a three-peater. Dr. Fornari, this is her third time on the Faculty Factory podcast, episode number 36, way back 5 years ago, back in the day. Alice talked about how she'd helped launch the Donald and Barbara Zucker School of Medicine at Hofstra Northwell in 2008. They have 23 hospitals. And episode number 158, she talked about JiTT, just-in-time teaching, which is super cool infographics, content. You could look up JiTT online and certainly look back at the podcast, episode 158, where there are examples of all kinds of abdominal exams, ambulatory medicine, bedside teaching, feedback and coaching, a wealth of educational content put in just-in-time teaching. It's an application. It's an app. You get it on any Google Play, Apple Store. So two really cool, innovative, fun episodes. So go check those out. But who is Dr. Alice Fornari? Dr. Fornari is a professor in science education and family medicine. She's an associate dean of educational skills development at the Zucker School of Medicine at Hofstra Northwell and is the vice president of faculty development at Northwell Health Organization, which includes 23 hospitals. So she has a big plate, lots of hats, does super cool, interesting things. And today, Dr. Fornari and I are going to have a conversation about something else that she does that's super cool, but it's all really micro. What is the micro talk that you'd like to share with us today, Alice?
Oh, thank you. And thanks for having me. And I just want to say that I appreciate you talking about the JiTT infographic app, which is on Google Play as well as the Apple Store. We're in version 5.0, Kim, since I spoke to you. So that means it's been updated 5 times. And the most recent update has 250 just-in-time teaching tips on it. It's been totally redesigned to be sort of more mentally accessible with so many teaching tips. And I'm very proud because there are 2 new categories. One is health equity. So there was always diversity, equity, inclusion, and belonging, that DEIB term, which is so important. But now we have a health equity category because we have many JITs dealing with health equity, which is so important. And we have a brand new section that was actually initiated by medical students, those bright little people, and on communicating with patients. So I never had put anything on the app about communicating with patients. It was always focused on teaching. And they really asked me to do that, medical students. So I'm very proud of that. And it's been updated to have a thumbs up, thumbs down on every single JIT, sort of to give me immediate feedback. It gets into the mini and fast because that's what we need today. Nobody does anything that takes a lot of time. And it has the favorites feature, and the search engine's been greatly improved. So this is a work in progress, just to let anybody know, if you want to get into app development, it is not stagnant. You have to constantly be upgrading and updating. And all the infographics are culturally sensitive. And I think that's another important feature when you're using graphics. So it's been a big journey, and it's gone really well. So that's an update from our last podcast. So for today, what am I doing with the app? So the app is really micro content. People don't want to spend, they only read abstracts of articles. This is an infographic. What does it take to read it? It could take less than a minute, depending how much comprehension you want. But I'm also has some videos to go with it, some of the JITs, because people are saying, I don't even want to read something that takes less than a minute. I want to listen. Right. So we have to be attentive that people want micro. Micro. So if you have micro content, how do you apply it to micro learning as a micro resource? And then you use it to do micro teaching. So everything is micro. This was an adaptation for me, and because here I am, a faculty developer, and I love to give a workshop for 1 hour and have people in front of me and do activities. But people are not showing up in rooms today. This is not what life is about. People are really stressed, really busy, And even if they want to show up, they're not even mentally with you all the time.
Right.
So I have developed 10 to 15-minute micro talks based on the app, though. So the JITs are a takeaway automatically. They're visual, they're a takeaway, it's in the palm of their hand. But I take two related JITs. So let's say I'm going to give you an example. I don't know how many talks I give on feedback because it's just something we can never get right in the clinical learning environments. Residents complain, students complain. So if you take feedback, there's a very important JIT on feedback. It's abbreviated SFED because it's self-assessment, factual feedback, encouragement, and direction. Every JIT is evidence-based and has an article link out to support the content. And then there's a JIT on narrative assessment where you're writing the assessment. So I would take two JITs related to that, sort of bookends, verbal feedback and narrative feedback writing, and I would put them on a PowerPoint slide. And in 10 to 15 minutes, I join faculty meetings that are existing meetings. So I'm not creating a meeting. I'm just being invited to the first 15 minutes or the last 15 minutes of a faculty meeting. I don't care which it is, first or last. They choose. And I come on and I talk for about 10 minutes of those 15. I show them the two JITs on a PowerPoint slide. I assume they have the app as a takeaway message. And I review them and tell them how to use them in the clinical learning environment. I can do any of the topics. I have two JITs on emotional intelligence. So if you're talking about working with leaders a little more, or, people in leadership positions over residents or medical students, we do two JITs on emotional intelligence, what it is and how to develop it. If you want to discuss more about how to, if I'm talking to surgeons, I'll take two JITs related to surgery, which could be how to prepare to teach in the OR and then how to teach when you're in the OR, a stepwise process. And whoever I'm speaking to, I apply the content specific. And it's really worked out well, and I've enhanced and increased, of course, the amount of faculty development I'm doing. And of course, the world online. I don't think I run to a faculty meeting in person for 10 minutes. This is all done either, whatever your online system is, either Zoom or Teams or whatever you're using.
Wow,
So
Alice.
it's been
Oof.
very, very productive and exciting. And it works out well. So it combines technology, it combines the need for faculty development in a more expedited way.
Genius. Still love it. Still in love with this. So amazing. I want to get you and Dr. Anna Handorf, who does the Tiny Talks. Her episode dropped on June 28th. Between Tiny Talks and JITs, I think this will change the world. It's so creative. It's so smart. I had no idea you have over 250 tips now. What kind of experiences are the users having? I have had people ask me, well, what are your outcomes on the Faculty Factory podcast? Why you've been doing this, one episode every week for 5 years. Yeah, but are you really making a difference? Well, what are the outcomes? How do you measure impact? I'm like, well, certainly we have diagnostics on who downloads the podcast episodes, who goes to the YouTube channels, how not who, but how many people go to how many people have downloaded our three free ebooks on the Faculty Factory website. But still kind of that question, always kind of the existential question gets me like, am I making a difference? Does this really matter? Is anyone learning anything? Can you really learn anything in a couple minutes or listening to a podcast? And I think this work is so important. And how do you measure any kind of outcomes, or what kind of feedback are you getting from the end users or leadership? In other words, to justify the continuation of this effort? Because I know it's not cheap. You and I talked and you were trying to help me when I was trying to develop an app for the WAGs, the Writing Accountability Group. So this is not, an
Right.
easy lift.
Yeah, there's money that goes into this, and I want to publicly thank Northwell Health for supporting it. I feel very strongly that it be free 100% because I want the world to have this. And the minute you even put a small price tag, like even 99 cents on an app, yes, I could be making money, but then people would not have full access, and especially under-resourced countries. We are a very heavily resourced country, but I appreciate other places in the world. So Northwell Health has really been a gem about this.
Mhm.
So what I want to say about this question of usage versus learning, this is such a fabulous question because I am struggling. So this is the situation. We all have analytics that run behind, and we all have usage analytics. You have it for your work. I definitely have usage analytics. How many people have opened the app? How many countries are using the app? How long they download, how not just the app, but each JIT. How many times is that opened? JIT being just in time teaching tip. How long do they keep it opened? I have all that running behind the platform, and all that is usage data. Okay, so then you say, are people able to learn from an app? And that is a measurement that is very, very hard to understand. So I have tried to think about how to measure actual learning. I have mentally developed a model to try and do that with some teaching encounters and see if people who use the app are better teachers and using evidence-based techniques versus people who are not using the app. So that's one way that you could measure learning. So it's somewhat of a randomized thing, like you go to teach how to give feedback is a good topic, and you don't have any resources in front of you, but you want to teach your residents how to give feedback to medical students or faculty to give feedback to other, learners. And then suddenly you say, okay, here's in your palm of your hand a teaching tip. It's evidence-based. Can you follow this model? And then you see if somebody can learn from the app and follow the model and give better quality feedback. So those are scripted teaching encounters. You could take that to the authentic world, but it's less realistic because the pace is just so fast there, and you wouldn't be able to control, in that environment. It's so hectic in the clinical environments. So you certainly could do it maybe in the classroom, but not in the clinical environments. But certainly you can do that. See if an app content is improving the skill that they're working on. That for sure. The other thing is, I am in the process of a study, launching a study right now. I'd say in the month of July, it's going to happen. And I'm working with Miami, Oregon, Mayo, Emory, and myself to assess what the impact of the app has had on people who have used it. And we're sending it out to our preceptors at our respective institutions to get feedback on them saying what it's doing for them. Now, that is self-report, and we know there's a limitation on that, but it will help for that. But there's a really interesting feature of this study, which is something interesting for you, I think. I don't know if you've thought about this with your faculty podcast, Faculty Factory program, is I want to measure. Also, I have many people who have created my JITs. So the JITs are made by hundreds of people at this point, maybe 100 people. I've never counted how many, because I'm not a content expert in many of the areas on the app. So I have content experts making that content. So all the apps that deal with OBGYN are made by OBGYNs or pediatrics or surgery. So we're doing qualitative interviews of a random sample of people who have developed JITs, and they're published now, to study what the impact is on them, to see their content published, and what got them to make the JIT. Why did they do it? What was in it for them? Professionally, did they feel this was satisfying? Did it add, you know, great warmth to themselves to see this published JIT and then be able to show people, I did this JIT? And I want to know about career satisfaction. And that really connects indirectly to
Yeah.
teaching and learning, because if people feel satisfied in their career, satisfied as clinician educators, then that will improve, I feel, their teaching. Because when you feel good about something, you want to do more of it. So if you really feel like, well, I'm an expert in giving feedback now, or I made a JIT on how to teach in the OR from a surgeon point of view, then therefore I want to use that JIT and be a better teacher. So
Oh,
it's an indirect road to career satisfaction, but I do feel it's there. So we're doing qualitative interviews for that part of the study. And we really want to get at the words of the people who have created the JITs and they've been published. And we're doing a random sample. Our goal is about 50 interviews, is our goal. And I'm getting help from the partner institutions.
what
And
a twist. I love
yeah,
that.
so that's an interesting twist a little bit, because it's not exactly measuring learning, but it's measuring somebody who really got embedded as a creator of content in the app, and what did that do for them. And I'm hoping that it creates an environment of positivity, and that will enhance people about the app and the function of the app as something that is really created for people's professional development as well.
So smart, super smart to flip that script. I never, ever would have thought to turn that around, measuring outcomes or measuring any changes in knowledge, attitude, skills, behaviors, status or condition, the initial outcomes, intermediate outcomes, long-term outcomes. I never thought of that as from the creator or the deliverer's point of view. And you're right, it just makes so much sense, not only in creating a culture and sustainability in terms of this felt good. I'm doing what I should be doing. I'm seeing measurable change. I feel like I'm making difference. I want to do more of this. It's contagious. And then that could be the platform, as the teacher, the educator, that's a platform to grow and invite the learners to that you too can do this.
Right. So it's a role modeling of,
Yeah.
using technology. And of course, our learners are all about technology. It's somewhat mini scholarship, getting into the mini talk. I spoke about spoke about micro content. I spoke about micro resources, micro teaching with all that. But this is micro scholarship.
Yeah.
It is a published content that you created. Yes, I have a creative designer who makes the visuals, but it's your content. Your name is on it. Whoever made it, their name is there. And it's your micro scholarship. And I encourage people to put it on their CV as micro scholarship.
It's intellectual property. You're so right, Alice. Whenever I send an email on Friday mornings when someone's episode drops in the podcast, I give them a suggested way to put it into their CV as other social media that it counts toward hopefully promotion, minimally recognizing that you're making an impact in the field. You are spreading, you're having national, regional, or international impact from your work. So you're absolutely right. And you're reminding me also, I just remembered Dr. Michael Gottlieb's episode. He's from Rush University Medical Center in Chicago. He did a study that was just published in, maybe it's not official yet, I think it is, in March in Academic Medicine, March 2024, called Educational Podcasts, Effect of Content Delivery Timing on Knowledge Acquisition and Retention. So there's a whole podcast episode that just dropped with Dr. Michael Gottlieb that did something to what you're talking about, demonstrating the efficacy of learners using podcasts to learn and engage. And he compared driving in a car, listening to a podcast versus sitting in concentrated focus. And there's actually no difference. So it's also an endorsement for what you're saying, Dr. Fornari, that we just in time teaching, the JIT, the any of these micro capsules, the tiny talks that Anna Handorf's doing at Harvard, this is, as you said so rightly, this is the future. We have to capitalize on learners in the future, learners now, who are not ever going to be going back to an auditorium and sitting in a chair for 3 or 4 hours. It's not going to happen.
It's not happening. And I think as faculty developers, which is what I consider myself, or, developing professionals, this is important, that we move to understand where people are today, and this is, just one of the things that I'm adjusting to. Also with mentoring, it's interesting because I do a lot of mentoring, and I'm very involved in mentoring. I've published a manual for IAMC on mentoring, but really, is there a place for more micro mentoring? So I was talking with the person at our institution, Northwell Health. He oversees physician leadership. And we thought about maybe starting a drop-in sort of micro mentoring system where I want to be mentored, but I don't want to commit to like a whole long thing. But I have some questions about, how do I become a clinician educator? I want to be mentored, or how do I, get promoted, or how do I, add something to my career, be it research, leadership, whatever. And there would be like micro people who have micro, who would be willing to do micro mentoring. And you would look at, perhaps have profiles online, and people would pick somebody to talk to. So the mentee would be the aggressor, which I think is important, and want to talk to somebody. So it's sort of like counseling, but not really. It would be mentoring because you have expertise in that area. And so very career focused. And we thought this would help some of the physicians, because most physicians, when they're mid-career, start to say, so what else could I do?
Right.
I've done a lot of clinical work. And 100% clinical is pretty much a burnout situation today. I have 2 children that are physicians, and both of them have academic roles. And I don't think either of them would want to do 100% clinical. So physicians start thinking about this, and what else could I do? And there's many options within health systems today. You could go into quality, you can go into, health information technology. There's many things. You can become a clinician educator, so you get involved more in education. So I think this mini mentoring even will become something, perhaps. I'm not doing it currently. I'm doing more long-term mentoring. But I see a place for this, and we're going to see what the health system thinks about this and talk to some people.
Yeah, I think you're right, Alice. And you recently becoming a certified ICF certified coach. To me, this is where I'm kind of headed as well, that using coaching and trying to find ways to do peer coaching, group coaching, coaching boot camps that get at that kind of short duration relationship of, I really want to develop some leadership skills, or my goal is to apply for this position, or my goal is to be a better communicator. And so you can do it on these micro bursts with a coach, with peers. So I think there's ample opportunity for us to come up with some really cool ways to deliver content and for learners to learn it, but doing it efficiently. They can do it on their own time, have people like us ready, so it can be a combination of asynchronous learning, but that there's an app, there's a JiTT, there's a Tiny Talk, there's something, and then a component or ability to practice that skill. Because I think what's missing is when you listen to an app, you listen to a podcast, you watch a PowerPoint slide, or you listen to a recorded session, that listening, is not enough to get you to do the thing. And then once you feel like, well, I've learned it, how do I practice it so that I am proficient in it? You can't just say, check the box, I listened to that module of fire safety or the shooter drill. it's kind of back there, but you're not really doing it, right? So we have to think about the doing and the practicing and the behavior change.
I think that's so important. So that's one of the things that I've been able to accomplish with my quick micro faculty development. So yes, oh, I see this JIT on how to prepare to teach in the operating room and how to teach in the operating room. Two separate JITs, how to prepare a learner and then how to in the operating room. But what how do I do that, So I create a scenario, you have an MS4 student with you and they want to go into surgery and they've expressed to you that they really would like to be involved in the operation today that you're taking them into. And you open the JIT on how to prepare for them to go into the OR. And it gives you like a 3-step process where you talk to them about the case. You make sure they have an understanding of what's going to happen in the OR. And then, of course, ask them if they have any questions or concerns. Then, okay, you step into the OR with the learner, and then you actually have discussed how it's going to work, what you're going to do, what they're going to do, if you're going to allow them to do it. And once you're in the OR, you take that JIT, or you looked at it before you went in the OR, because it wouldn't be, obviously sterile to do it in the OR. And you looked at, okay, you say to the learner, this is what I said you would be able to do today, and you prepared them, and then they know what they're expected to do, so they don't have that unknown fear of like, what's he going to ask me to do today, or can I really do it? And then you say, I'm going to observe you. I'm going to give you some feedback. If I feel you need guidance, I'm going to interfere at that moment and help you. And I expect you to give me some feedback if you're uncomfortable about anything. So there's a whole conversation with that teaching. So I use like a little mini case and then apply the 2 JITs, because that's what you're saying. Like they could read the JITs, but what does that mean? So I actually create like mini vignettes, very mini,
Yeah.
I'm doing one in anesthesia on Monday. So for anesthesia, I took the JIT on how to intubate. There is a JIT on the evidence-based way to intubate. It was made actually by an emergency medicine physician, but it's still very relevant to anesthesia. So I made a vignette about a patient who comes into the emergency room short of breath and, is struggling with breathing. And suddenly, the saturation of the oxygen goes down and you decide you have to intubate the patient. You have a medical student there who told you they want to learn how to intubate, and you decide that you're going to give the opportunity. So you open the JIT, how to intubate, and there's a step-by-step procedure there, and you're able to go over it with the medical student and obviously then have them try. And the other thing you could do, if a medical student had said to you, I really want to intubate a patient today on this shift, I really do. I must practice this. It's very important to me. You can show them the JIT so they read it themselves and they go through the steps. They maybe even look at the evidence-based article. And then when a patient comes in that needs intubation, okay, I've looked at the JIT, I know the step. And then they're able to participate in the intubation. So you don't have to go look for the resource or anything. It's all in the palm of the hand.
And so the same thing as you're talking, because I'm not in an operating room ever, willingly, but we could do the same thing with the JITs around, and I imagine you do, leadership skills broadly, communication skills, negotiation, difficult conversations, the same thing where if I come to you and say, Dr. Fornari, I'm having some problem with my team. I'm being perceived as being a bully, or it's making, difficult work environment, I've been told, and I'd really like to work and learn about that, work on that. So instead of being the experiential component being the middle of the sandwich being the operating room, it could also be a meeting. It could be a team meeting.
Because I have a JIT on, how to create a positive learning environment, which is generic to anything, how to become an ally, how to deal with microaggressions that somebody might be feeling that they're experiencing. I must say, I don't have a leadership category on the app, But when people say, oh, you don't have this category, I'm always saying, make me content and we make a category. It was like the students who came to me and said, we really need some JITs, Dr. Fornari, on how to communicate with patients. And there are things that we really need to learn about how to do that. And the clinical teachers really need this. So, of course, they know what the clinical teachers need because they're the recipients. And they made all these JITs for me, these medical students, during their fourth year electives. So I'm up, the app, the one nice thing about the app, it's limitless what you could put on. There's, you can keep adding as long as I have the backing to do revisions. So that's what just happened now. So a leadership category, I actually have somebody at at the Zucker School of Medicine who does a lot of work with leadership. So I should talk to her to make some leadership JITs. It's a great idea.
I'd love to do some JITs. I would love to do leadership JITs.
So
I'm
that would
on
be
it.
wonderful. So, how to sit down and help help a colleague go through a difficult conversation and debrief an experience. So, there could be many different skills. Those skills, you've worked in leadership. That's why I have content experts make the JITs. It's not like I go and do that. Obviously, what I'm comfortable with, I make, and then I have other people.
Oh my gosh, Alice, still in love with this. Just so smart, so ahead of your time and forward thinking. This is the future. You've built it over 250 JITs, just in time teaching. Go to your app store, wherever you get your apps, and check it out. You'll be blown away by it.
And most likely, I think I have to be realistic. How is AI going to interact with this? So could AI be making the content? And then we'll have to give reference to AI, of course, as the creator of the content. This is the world we're living in. So I just have to keep being adaptable and flexible. And I just want to give that message as an educator. You can't be stuck where you are. You have to be adaptable and flexible. And always learning, continually learning. So these articles that were published in Academic Medicine that you mentioned by Anna and Handorf and Dr. Gottlieb, I'm certainly going to look at as ways for me to learn. There is a JIT on Chalk Talks. So if Anna is involved, there is actually a JIT on how to make Chalk Talks.
Amazing.
So amazing. I love.
Oh, Alice, I always get so inspired talking to you. I'm so amped up right now. I want to create a leadership JIT. I will talk to you offline after.
Not one JIT, but a category. So
a category. I will create a category of JITs. If you too out in podcast land are listening to this and you want to be involved and you want to create your own category for a JIT, Dr. Alice Fornari, check her out. Check out the JITs. And I'm sure you'd be very welcomed and it will be a wonderful experience for you. So, Dr. Fornari.
I have a pretty simple system to get the work done. It's not a burden. So I figured that out with my project manager. So
of course you did. Of course you did.
Well, thank you for this time this morning. A wonderful Friday morning with you, Kim.
I loved it. I love the work you do. I love the way you think. You're such a role model.
Thank you.
Hello, Faculty Factory listeners. It's your podcast producer, Casey Callahan. Please make sure to download our newest free Faculty Factory book called The Academic Medicine Starter Kit, Timeless Tips and Guidance for Early Career Faculty Members. If you haven't already done so, it's available on the homepage, facultyfactory.org. In addition, I wanted to let you know that as of October 2024, this podcast that you're listening to has had nearly 90,000 total downloads and more than 15,000 total YouTube views. And the Faculty Factory website has drawn more than 50,000 web visits from users in 122 different countries. We would love to invite you to be a guest on the show or share the Faculty Factory website, podcast, and ebooks to someone you think would benefit from checking it out. If you want to reach us to be a guest or nominate someone in our academic medicine community who you think we need to hear from, please visit us on facultyfactory.org and drop us a message there in the Contact Us page.
Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more. Get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.